these are the before pictures. I just want to point out a few things. Number one, the extreme thinning in the frontal third half of his head, and you can see especially towards in the middle, and especially on the corners and recessions. So here he is. It's now about 5.5 months post hair transplant. This is approximately, let's just tell it there, good. This is approximately 40% of the final result. And perhaps the camera can start to just catch the hairline, and if you can get it close up, it's really good as well, just to show how natural it is. Still a little thin. This is all transplant here, as you can see from the pictures, but remember, we're only at about 40% growth, maximum 50%. This will fill in. Take note how there is a fullness that appears in the entire head area now. Once the frontal, particularly 1/3, is filling in, it blends so well with the mid-scalp that the patient practically can have a full head of hair. In this particular case, for various reasons, we decided not to do the crown, and the crown was quite thin. I've recommended some therapy, which he's been using for several months, so we haven't used that many grafts in this particular case. We've saved a lot just in case there's any concerns in the future. I believe with medical therapy or camouflage therapy such as SureThick fibers, he would be completely satisfied with the final look of this.
We don't really always talk about scarring, and something we always fail to overlook is that you do very, very, very good scars. I mean, you take great care in minimizing the scarring with patients, right? I mean,
we always do our best.
Let's talk personal here for a second. Explain what you were like because in your nervousness, because frankly, you and I laugh about it, but there's a lot of people who do wonder. Go ahead. I'd really appreciate if you
I've heard a lot of horror stories online about transplants gone wrong. That's why I did my due diligence. Having talked to other doctors as well and seen a lot of reports online, I've heard about people being rare cases. I did not want to be one of them.
Yeah.
So that was my main fear.
You were very afraid.
Yes, I was. I didn't want to go to a doctor, then 5 years down the line have to find another doctor so you could repair what the first doctor couldn't do.
Right.
So coming here, I realized that everything was proper, and the way it looks, if I do need to come back, let's hope I don't, most likely won't be there.
Here. What was it about the work here and about this clinic that made you take that step? I mean, you could have gone anywhere, frankly.